Good morning, Lake Providence Church family and friends. Dr. Linda Plummer Ward here with the Lake Providence Health Ministry update. Let me start with a couple of announcements. The Lake Providence Family Life Ministry will have voter registration at the church on this Thursday and again on Saturday. Check the church website at lpmbc.org or the church's Facebook page at LPMBC Nashville for more details. Also on Saturday is the Health Ministry's Fourth Saturday mini-series. There will be a webinar on colorectal cancer at 10 a.m. on Facebook Live. You can find more information about this on the Health Ministry's Facebook page at LPMBC Nashville Health. Now, the coronavirus pandemic continues, of course, but due to God's grace and mercy, and our little efforts to continue to show love for each other by wearing masks, social distancing, and washing our hands, we are experiencing slowing of the spread of disease in Nashville and Davidson County and Tennessee. We were in the category with a growing number of cases and high positivity rates, with the potential to be placed among states like Arizona, Florida, Illinois, California, and a few other states, because they weren't doing well, and neither were we. But we are gradually improving now. Considering the metrics that are monitored weekly, we have not reached all of our goals, but we can see improvement that allowed us to progressively reopen some of our businesses and other venues. Now, some of the best news that we received in the last week is from the governor's office, announcing reopening nursing homes for visitation. Nursing home visitation was shut down early in the pandemic. One of the first large outbreaks in Tennessee was a nursing home in Sumner County. Nursing homes follow strict guidelines to recover and slow the spread of the disease in those facilities. Because different facilities have different infection rates and different rates of progress controlling COVID-19, individual nursing homes will likely have different policies regarding visitation. So before you decide to visit your loved one, make sure you call the facility for information regarding their specific guidelines and protocols for safety and control of the virus. Interesting update on masks. Initially, we thought that masks protected the person wearing it from breathing the virus, so we all wanted to wear the best N95 mask that we could find. Then we realized that masks don't really filter out all the virus, so we added a face shield and then social distancing along with the face mask. Now we know that masks can slow the spread of the virus by containing the droplets that come from the person wearing the mask and allowing fewer droplets to enter the atmosphere. Even more recently, we've learned that the fewer droplets is a good thing. So fewer droplets means a lower dose of the virus is expelled into the atmosphere, so less virus particles are available to be inhaled. Exposure to fewer droplets and fewer virus particles appears to correlate with a less severe COVID-19 infection. When we inhale more droplets, more virus is inhaled, and the infection is expected to be a more severe infection. It is thought that this may be part of the reason why some get cold symptoms and others end up requiring oxygen. I don't know about you, but I choose to be hopeful. I choose to continue to have faith in my God, who is always faithful to me. God's got us, y'all. Let's continue to represent Him by continuing to show our love for our fellow man and woman. And not just for those in our immediate circles, but for people everywhere. And smile behind that mask. You never know who you might bless. Choose to wear a mask, to wash your hands for 20 seconds, whether with soap and water or hand sanitizer. Choose to social distance, avoid crowds, and stay home if sick. Why? Because of the compassion for all that comes with being a child of God. Thank you for tuning in. Be safe, be healthy, and stay prayed up.